Really pleased and privileged to have Dr. Jeff Foster on the Get Real podcast. And it's a bit of a different topic. It's not really talking about business or being an entrepreneur or any of that stuff. It's talking about men's health specifically, and specifically testosterone as well. So welcome, Dr. Jeff.
Thank you very much for having me. It's very kind.
I'm pleased you agreed to do this. I mean, we've spoke about this since I've become a patient of yours, and it blows my mind that not enough people are speaking about it. But before we get into all of that, just introduce yourself so people know who you are and what you're about.
Sure, thanks. As you said, I'm Jeff Foster. I've been a doctor. This is my 20th long year, and I originally trained in A&E and GP. Left that to become a GP with interest in men's health about 10 years ago. And that was a very organic thing. I didn't really particularly have any desire at that point to be a men's health specialist. But at the time when I joined my NHS practice, I was the younger male doc who went to the gym a lot. So it was a kind of self-selecting thing. And blokes came to come and see me, and they'd say, actually, what do I do, this or this? And you realise there's no one to ask, and it was really weird, and it became really apparent that if you're menopausal, you go speak to a menopause specialist, or there's breast surgeons, or there's gynecologists, but for blokes there isn't really anything, and it's really bizarre because I think it's kind of assumed that each specialty covers men, but it doesn't really. So from that point, I went and sat in with some urology clinics and some endocrinologists, and got involved with the British Society of Sexual Medicine, and it all kind of grew from there. And then once it reached the point of sort of critical mass, I ended up setting up my own clinic because the whole thing around testosterone in men was just getting bigger and bigger, and I felt that it just wasn't particularly served well in the NHS because a lot of doctors don't know about it or care about it, and yet there's this massive group of men out there who are struggling. And it was a great way to try and help people out, really. And it's just growing from there. So, yeah.
I mean, personally for me, so just to give listeners or viewers a background of how I found out about you, it was September 2011. I had the TV on in the background while I was in the office, and I saw you on TV with a patient of yours. And I recorded it at the time because I'm like, as I'm listening to your patient give his symptoms out, I'm like, that's me, tick, that's me, tick. And as a result, I saved your name in some notes. I got your book, which it was a great introduction to it. And then it was about December 2 years ago that I made contact with you. And I was pretty determined. I was pretty sure that I was lacking in testosterone before I even came to see you. And sure enough, after you tested me, I was quite low. I was just explain if you would, if for context, the guidelines or the readings, whatever you would technically call it.
I think your original point is probably quite accurate, that most men, in my clinic, for example, the average wait time for a man to have symptoms before they'll actually come and see me about it is about 2 to 3 years, sometimes a lot longer, but it's often something that you just trivialize. So guys often feel that they fall into a cultural narrative in their sort of 40s and 50s of this is normal because it's what society tells me. So you should be more tired in your 40s than you were in your 20s and 30s. You might have been with a partner for a long period of time, but you don't want to have sex anymore because that's normal. You've been married for ages. Kids eat up your time. Your work takes all of your time. If you don't have time to go to the gym and exercise like you used to, and you might be more grumpy and you've got more responsibilities, all this sort of stuff. And you start to put it all together, and suddenly you think, well, God, no wonder I'm knackered and my life's terrible. And that, unfortunately, is true for 75% of men. That is just your life in your 40s and 50s. But for 25% of men, and that is a lot of people, there is a hormonal problem that we could do something about. And it's just because we're so entrenched and ingrained to say, actually, this is a cultural, societal thing that's normal as we get older, then most blokes just don't do anything. So it takes a lot of touch points for guys to actually go, actually, you know what, I will get my check my testosterone. I will go see a doctor about it, because most of the time you think, well, it's just my lot. And I guess the other thing that makes it even harder is that even if it was something that was far more well known, guys don't really talk about their health in the same way that women do. So when I've done talks to menopause clinics or to female health clinics about men's stuff, the general consensus is that women are very good at this sort of thing. They have like menopause cafes where this is a real thing, menopause cafes, where you come in and you all sit and talk about your menopause and your HRT, which to me sounds like hell. But for women, it's a great thing. As a guy, I couldn't imagine going to, if I had this problem, luckily I run the clinic, but if I wasn't in the medical world, I could imagine it'd be mortifying to sit in a room and talk about your erectile dysfunction with 10 other blokes you don't know very well. It wouldn't happen. And even if you went to the pub with your mates and started talking about that, it's probably how you lose your mates very quickly. So overall,
I was only talking about it last night, and I didn't lose any of my best mates.
That's the key. Yours is a difference to, joking aside, yours is different to the common ways that guys can tend to interact. And we tend not to talk about our personal concerns in the same way that women are much better at doing. And that has an enormous impact on how we access our healthcare and how we think about looking after ourselves. Because most folks will do anything to avoid having to come and see me. Oh, in terms of reference range is your original point, yeah. So actually, when we do check your testosterone, the guidance is that really we should be aiming for an optimal level of between 15 and 30 nanomoles per litre. And if it's below 12, the British Society of Sexual Medicine, which is the sort of the national best practice guidance that's come out last year, and we wrote the guidance, this is what we should be aiming for. So if it's less than 12, you should definitely consider being on testosterone. If it's between 12 and 15, maybe if you have something like type 2 diabetes or other risk factors, we might consider it. And if it's above 15 and your free testosterone, which is not the same thing, was also normal, we'd say you probably don't need it. The difficulty is that in the NHS, the cutoff range, depending where you're on the country, is far, far lower. So, for example, in Warwickshire, it's about 6 or 7. And when you ask them, how come your level's so low when we know that the guidance is actually 12 or 15, the answer is, well, because it's always been like that. And that's just the way it is.
Mine was 6 when I came to see you.
Which is terrible. It's bear in mind, we said the optimal range is somewhere between 15 and 30. And there are some studies that are suggesting actually keeping it in the mid-20s for your whole life is probably better. To have a level of 6, it's going to make you feel pretty bad, which I imagine it did.
Yeah, it did. Yeah, always around. Yeah, it was like I said. If I go back to the original time I saw you, your patient on there at the time, tick, tired, tick, all of it, every single one of them. I answered, "That's me." That was powerful.
What were the sort of main symptoms that thought you might have low testosterone?
Tired for no reason. Even though I work weird hours, I'm a late night worker, I'm not conventional. So, ridiculously tired for no reason. Lack of libido. One of your, I can't remember how you so medically eloquently put it, but was, how often do you get morning glory? And I'm like, once a month if I'm lucky. I can't remember how you medically termed it, but
yeah. Oh, just morning erections, but yeah.
Yeah. And I said, if I'm lucky, once a month. I've talked about it before. My mental health side of it, I'm on antidepressants in addition. So I wasn't too clear on could it have affected my mental health, the lack of testosterone. Looking back, I'm certainly better. Yes, my partner Gabby, I'm more energetic. I'm always round better. So I don't quite have a marker because I am on mental health. I'm on antidepressants, which again, is connected because I've got no problem talking about that either. So yeah, tired, libido, occasionally achy. I don't know if that was connected. I can't remember the other symptoms, if I'm absolutely honest, that your patient read out, but all of them was me.
You can imagine how it would be so easy to simply put that down to, well, I'm just getting a bit older, so it must be normal.
Yeah, I guess. Yeah, I guess you could have done, but it was in the context of you sitting. I think you were on a video call with your patient next door on the call, and well, his testosterone was so low. This is the reason why, and then him saying how much of a game changer it was. I'm like, and from that time onwards, I'm like, I must have it. I've got to have it. And yeah, when I made contact with you, it was genuinely a game changer. We talked about it when I saw you initially. Why nobody's talking about it. I'm paraphrasing, but you said I have some relatively high-profile clients, but no men wants to talk. Men don't want to talk about lack of testosterone or go anywhere near it. I haven't watched it yet. I will do, but I did see that you've got a patient of yours who is talking about it, Stephen Webb from Gogglebox, which is great. As I say, I haven't watched it yet, if I'm honest, but the fact that he's even prepared to talk about it and address it, do you think it's just a simple man-woman difference in talking about this? Do you think because it is testosterone, you're lacking in testosterone somewhere deep down in the psyche, you're lacking as being a man? I don't get it. I'm not somebody that's ever bothered about talking about any of this, so I don't get it. But you being the doctor, what do you think?
So testosterone you commonly associate with masculinity, and it comes with the identity of being a man. It's everything that makes you a guy. Before testosterone, you're a prepubescent boy, and for all intents and purposes, at least except for genitalia, virtually identical to girls. And it's purely the effect of the testosterone that masculinizes you as you go through puberty, which sounds very obvious, and we all know it does that, but it has these massively neurological and physiological changes in how we think that partly give us our identity. And being a guy is intrinsically linked to your production of testosterone and how you feel about yourself. A really good example is when you get prostate cancer patients and we have to give them drugs to effectively stop all of their testosterone. It's the exact opposite of what we're trying to do here with you. And that's because some types of prostate cancer, but not all of them, are fed by testosterone. So we actually block it in those cases, not forever, but during the treatment. For those cases, these guys become incredibly unwell from a psychological perspective, and they feel anxious, and they lose their confidence, and they lose their drive, and they say it stops them feeling like a guy. The other thing that, of course, testosterone does, it does provide sexual function, and it's not the only thing that provides sexual function, and not all of our patients do have ED, erectile dysfunction, or a loss of libido, but it is intrinsically linked. If you can't get an erection, or you can't have at least semi-decent sexual function, it really does impact on your mental health as a guy. And that ability to get an erection and have sex is something that's sort of core wired into most blokes as how they function. And if you suddenly take away the hormone that does that, it's really tough, because your identity starts to get pulled away, and that person you see in the mirror isn't the same person it was 5 or 10 years ago. So again, I've kind of deviated, but to go back to your original point, I think it's incredibly hard to talk about because men find it embarrassing. It's hard to identify with the fact that you're maybe not the person you were a few years ago. So you struggle with yourself. You struggle with the societal and cultural narrative that says what you should be as a guy. And of course, we're all trained still as kids not to talk about things that are embarrassing about our feelings, etc., etc. So, for example, my son plays rugby. He's only 11, but even a year or two ago, if he gets hurt or something, and the coaches are all shouting, not our coaches, they're very good, but we've heard other coaches from the team shout things like, don't cry like a girl, or pull yourself together, or man up, or something like that. All these sort of generalist phrases. Yeah, my daughter does gymnastics, and you'd never have that phrase. If somebody falls off a bar, they get hugs. Now, admittedly, some of that is changing, and I have to say our team in Kenilworth is actually brilliant, and they're really good at supporting their kids. But there is still that thing in the terminal, even in 2024, we're still embedding that into our kids that say, you know what, be tough, be masculine, don't talk about it. And if that's starting when you're 10, you can imagine how hard it's going to be when you're 35.
It's ingrained, yeah.
You can't undo that. And that makes it really difficult. So those people, a bit like yourself, actually, who are able to break away from that mold of don't talk about your problems are in the minority. And we need to try and encourage more men not to feel like they're...
I learned a lot when I started talking about my battles with mental health, which is now I'm 20 years off and on into that. And I shared a lot about my battles with mental health, depression, medication, and I'd get very few public likes, comments, what have you. But every time I posted about it, I'd always get private messages from people that I knew that you would just never think would be struggling out if you on the outside looking in. You'd never believe it. Pretty much, I think there was only one time I didn't. Any time I've ever posted on social media about mental health and any personal stories, I'd always get direct communication, but I'd never get public. And that taught me a lot because men do want to talk. Some men feel the need to, but they certainly don't want to talk about it publicly. And they have to feel that they, trust the person that they're talking to. I speak to people now still that, we chat about it and my lines of communication open if they need any. And I always finish it by saying, if you need any help. And it's getting that shift. Now, the reason I'm talking about that is because it's linked. Certainly, from a personal point of view, well, really quickly, again, keep digressing both of us, but the process for me was so easy. I went to see you, which I didn't even need to do. I could have done it virtually like this. I've never, all through the process, we never actually had to meet face to face.
No.
It doesn't matter where you are in the UK. I assume it is only the UK that you can,
Yeah.
So wherever you are in the UK, you don't actually have to be in the Midlands at all. I wanted to go and meet you personally, but we didn't need to. Initial consultation, fill in anything I'm leaving out that's important. Mm-hmm. Initial consultation, you asked me some questions. You arranged for a blood test, which I arranged for somebody to come to my house. Didn't even need to leave my office for that. Blood test gets sent off a few days later, results back. And then you issue with very good guidance and what have you as to actually how to do it. There's two types. There's a gel that you can rub on, or there's an injection into you, or I do it into my thigh. I couldn't be bothered with the gel, having to remember to do that every day. Thigh every 2 weeks, which I'm actually gone to every week, but we'll talk about that in a minute. But yeah, so, and actually, once you've got it, it's relatively inexpensive. The actual testosterone itself's cheap, I would verge to say.
Yeah.
And then for 2 quarters, I get checked in with you again. The first time, I can't remember. My hemoglobin was high, if I remember.
A bit too much.
And then, so that was me. And there's 2 types of injectable, correct? There's one that gives you more of a...
there's 4 types, actually, but just for you, we did the 2 standard ones. Fine, but yeah.
So one gives you more of a boost straight away, and one is more level. I went with a level 1, or you suggested a level 1 because of the other medication I'm on. And realistically, within 3 or 4 days, I started seeing changes. And we changed from every 2 weeks to every week, but half, which seems to have cleared up the hemoglobin, what have you. And that's it. and certainly the benefits are, as I say, I've definitely got more energy. I feel better all over. Sexually, not necessarily good for all parties, because my partner Gabby's calling me like I'm a teenager again at the age of 48. Amazing. I'm not saying I necessarily had erectile dysfunction prior, but what I did have is nowhere near the result, a lot better as a result of taking testosterone. Sometimes I would struggle to perform, let's say, which again, psychologically is a bitch as a man. And what it does is it gives me the confidence to know now that, again, let's call it as it is. It gives me the confidence to know I can perform to a lot better in my own head standard as a result of this. And that's a hell of a confidence boost. It psychologically, it's amazing. Yeah. So for me, more energy, the immediate is more energy, libido, and just a game changer, really. But there's a lot of long-term health benefits of getting your testosterone sorted out. What can you tell people what they are?
Yeah, of course. I think testosterone more recently has been examined much more closely, because the previous thoughts around testosterone were that if we give you external testosterone, we either increase the risk of prostate cancer or we potentially increase the risk of heart disease. And I think that kind of stuck in the mindset of a lot of doctors even now. Most recent studies have shown that neither of those is true. And in fact, the most recent data suggests that unless you had prostate cancer already and we didn't know about it, having testosterone higher or lower levels does not increase your risk of prostate cancer. In fact, having very low levels of testosterone can increase your risks of invasive prostate cancer if you were to get it. A bit like taking finasteride drug that improves your hair or your prostate, a similar sort of picture. The other thing is it doesn't have any increased risk in terms of increasing heart disease. In fact, the opposite is true. And we know that men with low levels of testosterone have increased risk of type 2 diabetes, heart disease, cholesterol, and blood pressure. There was a massive study, a really decent study published in the Lancet a year and a half ago, which is like, kind of the Bible of medical journals, and called the T4DM study. And this looked at giving men with type 2 diabetes and low testosterone a trial with testosterone to see how it affects their diabetes. And they found in even just a 2-year period, around 15 to 20% could come off diabetic medicines completely, and around 15% of those that had impaired glucose tolerance went back to normal. Now, this is adjusting for things like lifestyle changes, eating better and exercise. All these things are all adjusted for. Purely the drug itself improves metabolic outcomes for men. So you could argue, really, we should be screening all type 2 diabetic men for low testosterone, especially as we know that 50% of them will have low testosterone. And if we can improve that, why aren't we? The overall data is that men with low testosterone levels have increased risks of heart disease, bone density problems, mental health illnesses, depressions, anxieties, ED, type 2 diabetes, cholesterol. There's a whole list of this stuff. There's even query links as to whether it can be linked with dementia or not, but I'm not sure how good those studies are. If you put the levels back to normal, then we're not doing any harm. We're literally just replacing what was there before. The only time it becomes risky is if you go too far the other way and you start doing it in an unsafe, unmonitored way, and you're just taking whatever you want because you thought it was a good thing to do. But as long as you're under a doctor who knows what they're doing, really, we're improving your life outcomes. So yeah, we need to move away from that idea that testosterone is bad for you. Actually, it's a really good drug.
Well, I went to my doctor's for my yearly meet-up, as I call it. And obviously it's on his notes that I'm under you for this, because it's all shared and what have you, isn't it? So, and he asked me, how is it? I told him what I've just said to you. And I had a bit of a joke with him. I said, not necessarily good for everybody concerned, but it's great. A genuine game changer, overused phrase, but for me it is. And he asked me, he said, do you think it's positively affected your mental health? And I said, yeah, probably. It's very difficult though, because as I say, I've been on a level of antidepressants for quite a long time. So I don't know how I would be. I know I wouldn't be great without those, but I definitely feel I'm not. I'm not saying that I don't have crappy days or occasional down day, normally 1 in 30, which is great. And that lasts the day. You go to bed, you wake up and you crack on and you're all good again. But there's definite shift in energies, attitude, confidence, the metabolism, maybe. I mean, I walk about 8,000 steps a day, walking my dogs. That's about all the exercise I get. So what I guess I'm trying to say is I've definitely seen the benefits, but like you've just said, it's not just the short-term immediate things people will see when they start taking it. There's so many long-term health implications of having it. What is an extremely low level, would you say? And because it sounds balmy to me that in Warwickshire they won't treat somebody that was at my level.
It's not just Warwickshire. This is a national thing, and it's driven by historical reference ranges. I think there's a couple again about papers around what the comparison is around reference ranges for national testosterone, and maybe they'll catch up in the future. But I guess for many NHS England reference groups, pathology labs, etc., testosterone deficiency isn't the target. I mean, the NHS is really struggling, and they can't meet their cancer wait times. They can't meet. You're waiting a year and a half to see a surgeon. A&E 4-hour waits are out the window. You can't see a GP for 3 weeks. So to then say to people, actually, now I want you to fund a better drug that's going to give people a better quality of life and have better sex, this is what they see it as, they're going to go, I'm not doing that, it's not a priority. So we can argue that it does cause better health, and we know it does, but those are long-term changes. The stuff about improving diabetes and improving your bone density, that takes a couple of years to take effect. And when you're in a very strapped financial situation, you need short-term gains. These are not short-term gains you're going to get. And I think in many ways, like HRT is seen in women, it's a lifestyle thing. No, it's just how you feel. It's not a big deal.
But I don't get it. Maybe I'm being naive, Doc. I don't get it, because actually outside of the initial treatment, the actual testosterone itself, I don't know. To me, it seems relatively cheap. Is it cheap within an NHS perspective?
Yeah, it's very cheap. It depends where you go, obviously, in terms of private clinics, and certain clinics will make a markup on drugs in terms of what they charge you. Obviously, we don't do that, but if, for example, an injectable testosterone like an Anthate or Sustanon or something similar, it's about £13-12, maybe even less than that, and that's every 2 weeks. So it's a cheap drug, and even within the NHS, that's not exorbitantly expensive. The problem is not necessarily the cost of the drug; it's the specialist input that needs to go
training and all the resources it needs to implement.
Most GPs are already stretched enough in terms of trying to manage their standardized workload, and we can't expect them to then say, right, I need you all to learn now a specialist area that took me several years on top of that to learn. And I wouldn't expect them to do that. That seems unfair. What they could do in the NHS, however, would be allow these patients with lower levels, so less than 12 or 15 or a low free testosterone, to at least have that discussion for referral to speak to somebody who is the specialist. And I think that does need to change. But, I think we're years behind that still.
But 1 in 4 men over the age of 30, am I correct in that? I've got low testosterone?
Yeah, it's a little bit more complicated, but the general statistic is 1/4 of all men over 30 at some point in their life will have low testosterone. Now, that doesn't mean they all need treatment, because of course that varies. And something like the Male Massachusetts Aging Study found that it's around 11 to 12% of men between 40 and 50 have it. So it does vary depending. I think over 50 it drops dramatically, but between 40 and 50, around 12%ish, 11 to 13% they kind of showed. So, but even if you took that and you said, well, it's only 1 in 10, that's a lot of men have got a condition, because very few conditions in your 40s have a prevalence of 10% of the male population. And if you look at 25% total, that's enormous. We've got about just less than 1 million men diagnosed in the UK on treatment as it is. So I suspect, even with that number, there are many thousands of guys out there who are walking around feeling terrible, not knowing how to manage it. But
so yeah, do that. Get right now. If people are listening or watching to this, and guys are watching this, or partners of guys are watching this, what are the symptoms that would make you think that they need to look at it?
Okay, so you break it into 3 basic things. So physical, have you just become more tired, more fatigued? You can't necessarily get through your day. Maybe napping in the evening, or taking a break and napping at lunch if you can. Feeling maybe you're going to the gym or exercising and your body's changing shape, but you're doing everything the same you did 2 or 3 years ago. To me, you're putting on more fat and your muscle mass is dropping, but nothing else has changed. Why am I doing this? The mental health side of things, you just become more grumpy, more irritable, lose your mojo, your lust for life disappears. People feel like they just can't be bothered anymore, and their enjoyment of things disappears. As that gets worse, guys also start to notice that they get memory problems. They can't remember names or where they put their keys. And we've even had a couple of patients get told they thought they had early dementia, whereas it was testosterone dementia. And the other side is sexual. And these guys will initially just have a slight drop in libido. They won't be as interested in sex as they used to. And a proportion of those men will also get erectile dysfunction. If you're not sure, could it be that side or not? One of the really good factors, as we discussed, is just, can you remember the last time you had regular morning erections? And if actually you think, actually, I don't remember that time, then that's a sign in itself, because you naturally produce your testosterone in the early hours of the morning. It peaks between sort of 5 and 8 a.m., then it gradually comes down during the day. So that's why you get morning erections. It's not because you need to pee or anything. You wake up because you need to pee. The erection should be there anyway. And even in your 40s, 50s, 60s, you should get it a couple of times a week. And if you're not, is that testosterone starting to drop? I would say it's really important. You don't have to have all 3 of those sections. It doesn't have to be physical, mental, and sexual. A lot of our patients will only have 2 of those, or 1 of those. And a really, really common one is guys just going, I just don't feel like I can be bothered anymore. I'm really just about my life, just lost interest in everything, or they just can't remember their work is failing. And it's that kind of social thing. And it turns out it's a hormonal issue. So it doesn't have to be that. I think it's not a panacea for all male health issues. You know, it's not going to help every guy, but if you get it right, like in your case, it's a game changer, and it makes a real difference.
Yeah, I mean, for me, I couldn't say that the mental side, because I had the other medication I was on, but the other 2, definite, hands down, definite. And so anybody watching or listening this now that's suffering this, one, I'd say I delayed it for 2 years. I guess I delayed it because I felt it was the right time when I called you. Naturally, when I booked the appointment, I thought, right, I got to get this sorted now. I've left it too long. But it's reassuringly simple. It's not. It's again, I'll put it in my own words. Doc, correct me on anything I've missed out or what have you. But simple blood test, as you would get at your doctors normally. A few days later or what have you, within a week, you get the results back. I can see them, get them sent. You send them to me. You go through it. You discuss it. Obviously, in my case, it was 6, which is quite low. There was in my case, because there's another hormone, isn't there, that again, in my own words, tells the body to produce testosterone.
Yeah, that's luteinizing hormone from your pituitary gland.
So you discuss all of that, and then you decide which, if you need it, you decide whether you go with a gel or the injection. The injection's nothing at all to worry about. simply intramuscular injection into your thigh or your backside. Again, I started every 2 weeks. Now I'm doing half every week. And that's it. I've got a little box up there in my office that I keep it in. Every 3 months, initially, you do a check, another blood test, another consultation. So I've had 2 of them, albeit the last one was slightly delayed due to diaries and what have you. And now I think am I on every 6 months now?
Yeah.
That's right.
Mm-hmm.
Yeah. So every 6 months I check in with you, do that. And it's funny because I take mine on a Monday. I don't know how this fits into medically. I take mine on a Monday, and taking it on a Monday, I seem to be feeling the very best around Thursday, Friday. Again, perhaps different for everybody, because it's not the one that gives you the initial boost.
No. I think really for you, yours is pretty stable throughout the week now, which is really good. There is no giant peaks or troughs. I mean, to go back to your original point, the process of it is actually quite simple. And you're right, you can do a face-to-face. And a lot of guys don't want to come to face-to-face because they're nervous about things like prostate checks and do you get a rectal exam and all that sort of thing. And I should point out the latest data is that unless you have symptoms, a PSA blood test is as accurate as a rectal exam. So we just don't need to do that anymore for most blokes. It's absolutely fine. The concept we've set up is that you can do this virtually. We have little clinics for blood testing all over the UK. So you can go to anyone where we get you to go to. That's absolutely fine. The only thing I wouldn't do is just buy a testosterone test off the internet and test it yourself without speaking to a doc first, because the problem is, what do you do with that information? If the level comes back fine, does that mean you're okay? What about your free testosterone? What about your luteinizing hormone? What about the other things that go with it? And if it doesn't come back okay, is that because of the time of day? Is it because it was being impacted by something else? Is there another medical problem causing it? So no matter what happens, if you do the test yourself, we're going to need to repeat it and we're going to need to get more information. So actually, you're probably wasting your money. So my advice is always find out what test you need. Don't just start randomly picking tests, because odds are, best case, it gives you a false positive and we could tell you you're okay and it's fine. Worse, it gives you a false negative. You're falsely reassured that everything's fine and you've missed the diagnosis we could have treated you for.
Yeah, look, my suggestion to everybody watching, listening this is this: wherever you are in the UK, and we'll get on to how people can contact you in a minute. Wherever they are, wherever you are, if you're listening to this, watching this, thinking, that's me, this is what I would do, this is what I did. I went and got his book. I get nothing for pushing the book. It's a good book.
Okay.
What sticks out to me on the back is you said being a man is bad for your health. Not only do men have great chance of getting almost every illness, but they die sooner too. 1 in 5 men that die before the age of 65. So why do so many men still accept poor health as a consequence of just getting old? That's quite powerful when I read that first time. Makes you think a lot. Do that. And if you think you've got this, get in touch with Dr. Jeff. And we'll cover how to do that in a minute. And it's within once you've got the consultation, within a week, you'll know if you will tell your patient if they are lacking. And it is so easy. I can't stress how easy, painful. There's no pain involved in it, and it is such a game changer for me. And what reassures me that I know it's a game changer is that my partner, Gabby, tells me she can see a massive difference in me. So it's not just me thinking it's a game changer. I've got, I've got, morning erections again. It's not that. It's she can see a difference in me in many ways. That's reassuring to me. I was at dinner with some friends last week talking about it, and Gabby said, I can definitely see, a difference in Mark. Because one of the things that you said, or I read, I can't remember who it was, on average, again, correct me if I'm wrong, after the age of 30, men can drop 1% a year in testosterone.
Yeah.
So there's all these men over 30, certainly into their 40s. For me, I'm looking back, reflecting. I think I started having it 40, 42, probably 42. It kicked in for me, and I'm 49 next month. So I've been knocking around with this for 6 or 7 years, and for what?
Yeah.
So yeah, that's my advice. Don't go on, get tests. And again, I'm not the medical professional, but somebody that's gone through it, don't waste your money going through all of that and try and do. You need. It's like this. The second test I had with you, you said your hemoglobin's high. I don't know what the health implications of that. You do, and it ain't right. It's got to be tested, and that's what you need. And what I will say is, once you've been through it, it's not cheap seeing you, but at the same time, it's not ridiculously cost prohibitive.
Yeah.
I would guesstimate it's cost me about £500 or £600 at the moment, roughly, with blood tests and your consultations, what have you. But what I do know is that actually the testosterone cost me about 22, 24 quid a month. And that's really very great. What a cost benefit that is. So it's just, it really gets to me that men won't talk about it. I'm in no way, shape or form geared up to shout from the rooftops like somebody like Stephen Webb is, or other people that you've been. But I do know this, that through my own network and I'll tell everybody. I'll talk about this because men need to talk about this more, because there's the idea that there's tens of thousands of men running around the UK that are suffering this, not talking about it, and relatively simply can get help. That's mind blowing to me. We just need. We said when we first met, we need the male equivalent, big, powerful, Davina McCall spokesman.
Yeah.
What Davina McCall's done for menopause, we need to do it for this. And until we find that person, then all of us have got to talk about it. I literally was in the pub drinking a Guinness last night, talking about testosterone. And I was at a dinner in Cheltenham a few months ago, and I've got a few guys around me. They may have even been in contact with you. The word needs spreading because it genuinely is a game changer. So based on that, how can people that are listening get in touch with you? What's the best way of, if somebody's watching this to listening to it now, what's the best way of them getting in touch?
There's 2 ways. So you can phone directly, which is on 0330 912 0769, and that's H3 Health. And our direct email is hello@h3health.co.uk. And they can email anything straight over. If they have sort of more personal questions about, is this the right thing to do, I'm happy for anyone to email directly at contact@drjefffoster.co.uk.
Well, I'll put all of those details on the back of this video for people, and in the descriptions and what have you. And do what I did. Go and look on Dr. Jeff's website. He offers great services for men, and we just need to talk about it more. And actually, the most people listening to this that are certainly already subscribed to my podcast, you guys that are listening to this are the most likely people to target age group. I'm thoroughly expecting feedback over the coming months and years from this podcast interview saying, Mark, thanks for getting Doctor on board, because it's going to help a lot of people. Thank you, Doc. I'm glad we've all got to spread the word, but to be able to get you on talking in an actual medical capacity rather than me just blabbering on in my own way, it's important, So yeah, thank you very much.
Thank you. Cheers.
You've been listening to the Get Real podcast with Mark Lyford. Being an entrepreneur isn't all glitz and glamour. Entrepreneurs are some of the most hard-working people in the world. And within entrepreneurship, there's life, mental health, business, ups and downs. And that's why we exist. Our passion is to talk about all of it with no BS. We hope you've enjoyed the show. Make sure to like, rate, and review. Find Mark on Facebook, LinkedIn, Twitter, and YouTube at Mark Lyford. And be sure to hit the website, realeNtrepreneur.com. From there, get his book. You won't be disappointed. See you next time on Get Real.